Mask mandates across Ontario will be lifted in most high-risk settings starting tomorrow.
That means it will no longer be required to wear a mask on public transit as well as in certain healthcare settings, though many hospitals will still require them. Masks will still be required in long-term care homes and retirement homes and are also being recommended in higher-risk congregate living settings such as shelters and group homes.
So let's bring in the province's Chief Medical Officer of Health, Dr.Moore. It's been a while since we've had you on the show. Welcome back. So the head of the province's science table and the Ontario Hospital Association both recommended keeping masking in high-risk settings. Why do you think you have differing opinions on this?
Oh, we don't have different opinions. The only thing that's happening is the transition from a mandatory order to a standard of care now. So we've created guidelines, best practices, and policies together with all of our health system partners, including Public Health Ontario and including our hospitals. And now it's a normal state of affair where we transition from an order to a standard of care. So my expectation is all of these sites and partners will continue with all of the best practices and all of the lessons learned that we've had over the last 2.5 years. So I have complete confidence for patients, healthcare workers, and their families that the standards will be maintained without the need for a mandatory order, which includes fines and risk of imprisonment, which we've never had to use.
So you expect that they will keep the masking sort of mandates in place sort of on their own terms rather than having the mandate imposed by you or the province, et cetera here. So why remove it at this point? We haven't found one infectious diseases expert who said this is a good idea at this time to remove masking mandates in these settings specifically.
Well, again, just for clarity, the guidelines and standards will be maintained. It's our expectation that all that we've learned over the last 2.5 years are now embedded in the standard of care, the standard of practice, and it's our expectation, absolutely, like all the infectious disease experts expect, that they will be maintained. And we have the guidelines that say, as of 12:01 on June 11th, that all of them have to be maintained to protect our patients and our workers. So I know there's a little anxiety anytime there's change, anytime we remove an order, but we've worked diligently over the last several months and clearly have warned that the mandatory nature of this will be removed and the expectation for the standard of care will be maintained. So I want to assure all Ontarians that they will continue to be protected in our hospital system. Masking will be maintained because we've worked so diligently together to maintain that standard.
So, Dr. Moore, what you're saying is that mandatory order is being removed. That kind of sounds like for policy reasons, and hospitals are still trying to maintain them. So why remove them at all? Because won't people be encouraged to be like, okay, I'm not going to be penalized, I can take off my mask?
Oh, so mandatory orders are always to be used for short term. They're to be an impetus to create a standard of care, and we have done that over 2.5 years. And just like we have to go back to normal, we have to remove the state of emergency in our municipal governments or the Emergency Measures Civil Protection Act at a provincial level, we have to, because they're time limited, remove the mandatory nature and replace them with a standard of care. And again, the standard of care is not changing. The protection of patients and workers and families is absolutely being maintained. As you've heard from many hospital leaders, this standard will be adhered to. And we've created the documents to give them guidance, and we've created extra infrastructure called infection prevention and control hubs to support all partners to maintain this standard. So I have confidence in the system. I have confidence that we no longer need fines and the risk of imprisonment, and that our patients, families, and workers will continue to be protected.
Okay, can I just talk about a couple of things from a document from Public Health Ontario in March of this year, so really just a few months ago, Dr. Moore. In a couple of lines here, one says, mask mandates in community settings was associated in statistically significant reductions in COVID-19 case growth. Another line from that same work says mandatory mask policies reduce hospitalizations or deaths from COVID-19. And another one says it observed a statistically significant increase in COVID-19 cases 45 days after lifting mask mandates. This is referring to early in 2021. So what do you think is the potential outcome of lifting the mask mandates based on what we know, what you've just talked about the last 2.5 years? Are you concerned that we are going to see a rise in cases here?
No, mainly because Ontarians continue to wear masks despite a mandate. We're cautious, we're careful, we're kind and considerate to one another, and I continue to see masking even outdoors, walking on streets in Toronto. As well, the difference a year ago is we have some of the highest immunization rates in the world, and not just first, second, third, but fourth doses as well. Almost 50% of those over 80 now have their fourth dose of protection. We also have tools like Paxlovid, so outpatient antiviral therapy. Over 18,000 Ontarians have taken advantage of those. So we have way more tools in our toolbox. We have a very protected population. And I'm just so happy to say all of the key metrics that we monitor, so hospitalizations, ICU, the percentage of tests that are positive, the wastewater signal, all of them on a rapid and dramatic decline. So we're in a safer position than we've been, and Ontarians continue to adhere to all the best practices. So 10,000 patients a day continue to come forward to stay up to date with their vaccinations even today. So our Ontarian response has been brilliant. I have to thank all Ontarians, because we're only in this position because Ontarians have accepted treatments, they have accepted vaccination, and they have accepted wearing masking where necessary. And I think it's at a time heading into the summer where we can remove the mandatory nature of masking, and Ontarians will remain cautious, careful as we head into the fall. But I hope enjoy a wonderful summer.
Yeah, it certainly sounds like it's going to be a great summer. Dr. Moore, but we know that vaccine efficacy, it does wane over time. And as we do head into the fall, when do you think the rest of the general public can get access to their second booster shots?
Oh, so we're reviewing all of that. So certainly all Ontarians 18 and up are have access to their first booster. We've kept the second booster, so that fourth dose for vulnerable populations 60 and up, and First Nations, Inuit, Métis members of our community. And we are reviewing the fall strategy, which may have a new vaccine that adds one of the newest circulating strains to the vaccine. So it may have two strains in it. So we'll keep you appraised of the vaccination strategy heading into the fall. I'm excited about that potential to further protect Ontarians, and knowing that our Ontarians have taken advantage of vaccination, I think it'll make a safer winter for us as well.
Dr. Moore, I know this isn't specifically part of your purview as the Chief Medical Officer of Health for Ontario, but this is having an impact in Ontario, and I'm referring to the testing at airports. As you are well aware, I'm sure it's leading to many delays at operations. Passengers held up for hours at a time. We've heard from infectious diseases specialists who said, it is time to abandon testing and screening at airports. What are your thoughts on this? Do you think it's time to let that go as well as these masking mandates?
I think returning to Canada not to have a test and trusting our vaccination and our monitoring of symptoms has worked very well. To test to leave is often in the purview of the country in which you're going to. So it's really negotiating with the United States, for example, and removing that testing strategy that they have mandated for us. So this is an international negotiation that our federal partners are going to have to go through, because the testing strategy and returning, I think it's been very helpful to smoothen the process and hasn't posed a significant risk to Ontarians, given that we have random testing that still gives us a signal.
All right, Chief Medical Officer of Health for Ontario, Dr. Kieran Moore, really appreciate your time this morning. Thank you and have a good weekend.
Thanks, Doctor.
Yes, you too.
All right.
Thanks so much.